We'll move on to a conversation that I know is out there in the ethos and being talked quite a lot, which is AI in healthcare. I'm really excited to have Dr. Patel here. And Sharon, I'm going to let you, as our member here from Jamir Health, introduce Dr. Patel and we'll get started.
Thank you, Rebecca, and thank you, Meg, for convening all of us. Sharon Casada Jenkins, Jamir Health. I'm the Director of Government Affairs, and I am delighted to introduce my coworker, Dr. Preeti Patel, who's our Chief Medical Information Officer, and with over 2 decades of experience in family medicine and clinical informatics. She leads the organization's clinical informatics program, AI governance, and analytics strategy. Dr. Patel has played a key role in advancing digital transformation by championing technologies that enhance clinical workflows, safety, and efficiency. Under her leadership, Jamir Health became one of the first health systems in the country to implement ambient AI technology at scale, an initiative that has measurably reduced documentation burden, boosted provider satisfaction, and enhanced the patient experience. Dr. Patel is board certified in both family medicine and clinical informatics and is a fellow of the Carol Emmett Foundation. In addition to her executive role, this doesn't surprise me, Dr. Patel remains active in clinical care. She teaches at our family medicine residency, and she volunteers with the Jamir Health Mobile Clinic, which just celebrated 25 years. Thank you, Dr. Patel, for being here.
Thank you, Sharon, for those kind words, and thank you all for having me. I'm excited to tell you a little bit more about what we've been up to. So let me share my screen. All right, so hopefully you can see that.
Yes.
Perfect, thank you. So as Sharon mentioned, I'm Preeti Patel. I'm a family physician and clinical informaticist, and I'm currently in the role of Chief Medical Information Officer, which means I'm responsible for our clinical informatics program, which is the discipline where you have people who sit in between technology and clinical workflows. That is my primary function. And one of the things that I've been involved in the last 2 to 3 years is setting up our AI Governance Council. So I'm really delighted to be here to share with you some of our journey that we've taken on in the last 2 to 3 years as AI has been transforming all of our lives as well as healthcare. So if I could leave you with just a few messages at the end of this presentation, there's 3 kind of points that I want to leave you with, and that is AI is here, and it's actually been here for quite some time. I joined the organization back in 2002, and shortly thereafter, I started using a software application called Dragon. It was a way to use a microphone, speech recognition. It would create my notes for me. AI wasn't very good back then, so I had to spend a lot of time training my Dragon and making it work as I wanted. But over the past 15 years before generative AI came onto the scene, we've been steadily implementing a variety of different AI. Some things you might be familiar with are allergy alerts, medication alerts. That's a form of AI. It's called rules-based logic, and those kinds of things are embedded in our electronic health records. So when I say AI is not new, it really isn't. It's been around for a while. We also moved into the world of something called predictive analytics. So we can predict clinical risk around many different things, and that's been in our EHRs and our workflows for quite some time. I think the real attention has been around generative AI, and I will tell you a little bit about what we've implemented over the last couple of years, but that's kind of the main area of focus. And I think when people think about AI and how it's impacting healthcare, they're really focused a lot on that generative AI. The second point I'd like to make is that we're really using AI as a tool. The American Medical Association calls it, instead of artificial intelligence, they call it augmented intelligence. And I think that's a really good term for it, because I think that's what we're trying to do, is assist and augment our clinicians and our staff. We expect that everyone is part of the process and the human stays in the loop and really maintains that oversight. And lastly, with being in Silicon Valley, it's hard not to see all the different amazing tools that are coming into healthcare. And as tempting as it is to implement all of these technologies, it's really important that we do it carefully, responsibly, ethically, really keep that trust. And so we focus a lot on privacy, safety, governance, and continued monitoring of our AI. So real quick, this is kind of what AI is and what it's not. As I mentioned, we think of it as a tool. It's powerful in many different ways, and I think everyone's used to how it works today in one's lives with maps and spam filters and drafting emails, voice assistants like Siri and Alexa. We're using this very similarly in healthcare with a slightly different twist because it's really about taking care of patients and making sure that it's absolutely safe. AI is very useful in recognizing patterns in data. When you think about the amount of material that's in one's medical record, if you were to print out a medical record these days, it'd be hundreds of pages. So to be able to really sift through that data in any kind of meaningful way and provide those insights that you need in that short period of time that you have with a patient, AI is very, very important and critical now. It has the ability to really reduce a lot of the repetitive work. And this is true not even for physicians and nurses, everyone in healthcare. You see everyone behind computer screens tapping away at their computers. So it has this potential to really automate and relieve some of those manual workflows that are in place. As I mentioned, there is vast amounts of information in the electronic health record. And now with interoperability, where we're connected to all these different health systems, how do you surface that really important data in a quick way, in a way that our clinicians and our staff can act on? So that's AI has tremendous potential in that area. And lastly, really, it's great at crafting and drafting routine content. So as it drafts your emails for you, it can do the same for notes and any other types of documentation. Where we don't see AI right now is as an independent decision maker. People talk about autonomous AI. We see Waymo's driving in San Francisco. This is not the type of AI that we are implementing in healthcare. It is not on its own. It's overseen by our clinicians and staff. It is not a replacement for clinical judgment. And these are messages that we really drive home on a regular basis, that really it is the clinician or the user of the AI that is ultimately responsible for its output. All AI must be reviewed. So this is the fun part where I get to tell you about all the neat features that we've implemented over the last few years. I mentioned our clinical risk tools. We started back in 2016 implementing a tool that helped predict clinical deterioration in our hospitals. So if you think about it, we've got hundreds of people in the hospitals right now, and it's tough for a nurse to be at the bedside 24/7. It's not truly possible. What our AI does is it's surveilling all kinds of data, over 100 different data points on our patients. It's looking at their vital signs, their labs, and calculating a score of what's the chance that they might deteriorate in the next 8 hours. It almost sounds like science fiction, right? But it's really there to provide that extra layer of safety. So if a nurse had gotten busy and may not have noticed, at least here now we're flagging, who are the patients that are at higher risk, and can we bring more care to them in that moment to avoid that deterioration in the future. So we've got lots of models like this running, ones that really will predict if a patient is likely to become readmitted after being discharged. And this type of information is provided to our case managers so they can make sure that the patient has really solid follow-up, has an appointment with their PCP. We've got tools that will predict opioid risk. So we are cautious when we're prescribing medications to people who may have a history of opioid overdose. And so there's over the next 3 to 5 years, I would expect a number of these models to be implemented. And we seem to be implementing newer models every 2 to 3 months. There's something new that goes live. The imaging space is another really interesting area. AI is very well suited. It's really good at reading imaging studies. Again, we don't want to have it do it on its own. We have a really neat product today that will detect stroke in a patient's CT scan within a few minutes. And once it does that, it alerts the entire treatment team. So are the radiologists, the interventionalists, and within minutes, everyone is able to confirm that there is a stroke and then bring people to the suite where the intervention takes place. We know that minutes matter when it comes to a stroke. And so this AI is really closing that window and really improving our stroke care. Our patients are noticing that there's some really improvements in some of the materials that they're getting. I think we're used to getting generic patient instructions. So when you see your physician, what ends up happening is at the end of the visit, let's say you have an ankle sprain, they'll send you home with some information. It may or may not pertain to what you have because it was created for ankle sprains in general, not your ankle sprain. If you see a physician today that is using AI, what it does is it captures the conversation and the advice that's been given by your physicians, and it creates that in a way that then is put into your documentation at the end of the visit. So now you have better communication and you have the ability to take care of your ailment in a more personalized way. Also, over the last few years, many patients are now messaging their doctors through their portals. In fact, the volume is increased by almost like 150%. So our physicians are responding to a lot of messages. At the same time, they're seeing more patients per day. That's just the state of healthcare. And so we are using AI to help them draft responses. We're also using the AI to identify when some messages may be of higher priority, so it's helping them prioritize what they need to address throughout the day. On the operational efficiency side, you can imagine scheduling is an art, and now we've got smart AI tools that will help identify where there might be some openings in a schedule, so that way patients have better access to care. And that's happening not only in our outpatient settings, but it's also happening in our operating room. So people who might be waiting for surgery now, we're able to increase our access because we're able to we sort of avoid having our OR stand still. And then the biggest win, I would say, I think this is the star of them all, is really the AI that helps with clinical documentation. Everyone's been burdened by documenting into the EHR, and this is really lifting that burden, reducing burnout that our caregivers have experienced over the years. So this is kind of the Mona Lisa of the clinical informatics world. So this drawing that you're seeing on the left side, this was published in the Journal of the American Medical Association back in 2012. It was drawn by a 7-year-old girl who was seeing her pediatrician. And you see her sitting there on the table, and then off to the right is her family. And then in the corner is her physician furiously typing away on the keyboard because, he has to get his documentation done while the visit's going on. So this was a very famous picture, and it was just kind of demonstrating the burden that the EHR has placed on all of us. But today, if you were to see a physician at John Muir, and over 60% of our physicians are now using AI scribes. I actually had AI redo this picture for me, and this is kind of what this looks like today. The physician is face to face with the patient, with the family, and really able to have that eye contact and that meaningful interaction with the patient instead of having to be a typist. So what other things people will notice, when you ask clinicians and staff, what are the benefits, what are the outcomes of AI? I think they'll talk about how it's really lifting that documentation burden, giving them more time back with their patients, but also at the end of the day, many of our caregivers have been going home, spending a lot of time. They call it pajama time, where you finish your documentation, and AI has really reduced the amount of time that's required. There's also the ability to surface better information through summarization tools. We also have better decision support. I think you've probably heard of physicians using a tool called Open Evidence. It's something that's available that will look at JAMA and New England Journal, and they can speak to it like a colleague and ask these very deep, kind of very specialized medical questions and be able to get answers to those queries and that are linked to journal articles and other citations. And so that's really raising the bar in, their ability to reach out to reference material in their clinical decision making. And so we have tools like that are embedded into our electronic health record. And lastly, I would say with all of this AI really relieving the documentation burden and some of the things that really weren't about patient care, the overall mental fatigue has gone down. There's studies that have been published nationally documenting that burnout has been reduced over time. On the staff side, they too are spending a lot of time doing repetitive tasks. And so, good examples of this would be prior authorization for medications. So, if a patient needs a specialty medication, your physician must provide some type of justification for it. This task was usually delegated to office staff, and they would have to sift through the chart to find the answers to the questions to supply to the insurance company. And now we have AI that will be able to extract some of this information from the medical record and populate those initial questions to assist the staff member who's doing that role. On the patient side, I think patients may have experienced some, it's hard to not tell when you're getting in sooner, but that's in general, we are noticing that patients are able to access appointments a little bit sooner. And then in terms of communication and follow-up, as I mentioned, I think the readability has really improved. So the ability to understand what is being shared with the patient, I think, has really changed. So now it's in patient-friendly terms, it's personalized to your care, and hopefully that makes it much easier to take care of yourself between visits. I don't know how many of you access your patient portal, but a few years ago, we made available all of your notes. So you could read the notes that your physician wrote. And unless you were had a clinical background, you probably couldn't understand a lot of that medical jargon, some of the abbreviations that they used. Now the AI drafts a note that is in full sentences. The grammar is correct. There are no more abbreviations, and most people can understand it. So that's a huge win. And I would say the biggest win is really getting your physician's time. I mean, how wonderful it is to be able to, I think on both sides, but as a patient, I would say it's so nice to have my physician's full attention because they're not tapping away on the computer. So what is coming next? There is so much on the horizon. I think that AI is really going to turn this around for the better. I'm very optimistic, especially when I've seen what's happened so far. So, we're going to continue to bring in smarter and smarter assistants to really help our clinicians and staff. I think many of you have had the experience of using tools like ChatGPT, where you can ask it any kinds of questions and plan your day and your travel and ask any kind of question that you have. And, I think there's 80 million queries about health that go into ChatGPT every day across the nation. So, people are using these tools. So we want to build in those kinds of tools for our clinicians and staff too. So a ChatGPT-like tool will likely be part of the EHR. Some organizations are already piloting tools like that. Care navigation is going to improve as well. So today, when you call into a call center, it's or your doctor's office, you are on hold. Some of the easier types of interactions, such as easy scheduling appointments or needing medication refills, that will be handled by conversational AI agents, always with the opportunity to speak with a human, but some of that volume could be offloaded and hopefully improve the experience when you do call in and need help to make appointments or to be able to receive other services. The whole patient-facing side of the electronic health record, so the patient portal today, I'm sure your experience is not as smooth as you'd like it to be. Sometimes it's hard to find the information that you need. When you look at what a lot of our EHR vendors are going to deploy in the next few years, are are voice agents and chatbots that you can then interact with to say, help explain to me what I was supposed to do after that visit, and what kind of reminders do you have for me? So a lot of that is going to be given directly to the patient. What's nice about having these kinds of tools in the electronic health record is that these are tools that keep your data safe and secure. So, I know that there's lots of tools out there and people are asking a lot of questions to, OpenAI and or ChatGPT, Google, Gemini. But, I think once there is the availability of this within your medical record, I think that's probably the place that most people will end up going. And then lastly, with all this new technology coming, while it's very easy to get excited and want to bring it on, and I think we have to do this very carefully and thoughtfully. There's a lot of momentum across the entire U.S. We do live in a state that fortunately sort of takes pause and does things very responsibly, and so we're definitely following a lot of the legislation that's in place and making sure that what we do is responsible and careful. So we have a AI Governance Council, which I shared that I lead, and it's a multidisciplinary council that really involves specialists from expertise from all different areas. AI is not just technology. There's so many considerations in place, and we want to do this safely. We want to protect data. I think your personal health data is so important, so it should be really depending on where you place your data, you should be very careful about what technology you use. Everything that we have available at John Muir is fully vetted by our information security team, and we encourage all of our employees to only use those tools. It's been very important for us to deploy AI at John Muir, so that way they are not looking to other sources or other technologies to manage their work. We have a lot of robust training programs to make sure that people understand AI and to understand, the inputs and the outputs, to be able to validate the outputs. And so whenever we've got sort of standard training across the board for every single employee at John Muir Health as part of our annual compliance training. But every time we roll out a new tool, we also will ensure that there's training around that. And lastly, we are tracking a lot of the California legislation. California is definitely a state that's very active in this space, and we want to make sure that we continue to engage with our lawmakers to ensure that the AI that is developed and the regulations around it is safe and also helps advance medicine. There's so much potential here. We want to make sure that the laws that are structured will sort of support that amount of innovation, but in a careful way. So we've got several guardrails that we follow when we're implementing AI. We do roll out most of our AI in the form of pilots, so that way we can make sure that we've covered everything and it is successful and we're not dealing with any unanticipated consequences. We want to make sure that there is constant oversight over the AI and vigilance. We ensure that all of the data is safe and secure, and that we are not going faster than we need to with regard to safety. It's just so important that those considerations are at the table whenever we make these decisions for implementation. And then lastly, just want to close to let you know that, I think in the end, humans are absolutely essential pieces of the care. AI is not going to be able to replace clinicians. I know that there's probably a lot of conversations about replacing workers in many different disciplines, but when you think about what is inherent to healthcare, it's really, really about that compassion, empathy, caring for the person. And I think, it's while a lot of the tasks that our caregivers do can be automated, you can't do that with empathy. I spent a lot of time trying to get that image of the AI bot holding the patient's hand, and in the end, it still looks pretty awkward. So I can't see that being something that would comfort me in the future. And you see the difference of the two human hands together, vastly different. So definitely humans will be at the center of care. So I will open it up to questions, but I hope you can see how the tremendous potential of AI. What it's done so far. It's really improved care at John Muir. It's really reducing a lot of our caregiver burden, giving the joy, bringing the humanity back into medicine, and really strengthening that overall patient experience and improving the quality of care that we deliver. And if you have any questions, I'd love to take them. Thank you for your time.
Oh, great. Thank you. Now that we're back in the room, that's really helpful. Um, does anyone have any questions for Dr. Patel?
I have a question, and I'm sorry I'm driving, so I don't know if I'm interrupting anybody.
No, go ahead, Joe.
Okay, great. Thank you. Thanks for that presentation, Dr. Patel. That was incredibly informative. I'm Joe. I'm the executive director of the local medical association, the ACCMA. And I was wondering if you could comment a little bit about like the culture of adoption within John Muir and whether you've seen folks generally be very receptive and open to these tools, or what kind of culture building you've had to do to gain traction and succeeding in the way you've described.
That's a great question. Well, nice to meet you, and thank you for asking that. I would say adoption for AI has been much easier than the other technologies that we've implemented. So I think, with the electronic health record, part of the reason why I have my job is my job was to be a physician champion, to really bring my colleagues along on the journey of the electronic health record. I am a technophile just by nature, and so it was easy for me, but it wasn't easy for my colleagues. When we implemented our first generative AI, which was the AI scribes, I mean, it was amazing. It was barely built. And, I think we were partnering with the startup. So the technology wasn't where it is today. Even still, you had people saying, please, 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 can I just try it? I need some help. They've been waiting for this for a very long time. So leading with that particular use case, I think gave a lot of confidence in AI for, people spoke of it more positively than anything else that we've ever implemented at John Muir. So that initial adoption was very easy. But what's interesting is, I think you reach a saturation point where you've got folks that will still, do things the way they've always done things. And, I think change is hard for some more than others. And, so there is a saturation point when it comes to AI. It doesn't work for everyone. And some people do take a little bit longer. Some of the other tools, I think, where people may not have been experiencing as much hardship, those take a little bit longer to adopt. People may not come around to it as easy as possible because they have their ways. And, I'm like thinking about, at least on the business side of the house, where you have, these processes where you fill out forms and, they just have their ways of doing it. So they don't adopt it as easily. But I would say AI in general has been a much easier implementation and adoption curve than we've seen with technology in the past.
Great, thank you.
Thank you.
I have a question, Dr. Patel. You mentioned that you are tracking what's happening legislatively at the state level, and so I'm wondering. I do hear about bills, but I'm not as familiar with them. But I'm just wondering, are there just generally what are you seeing the state wanting to do? Can you kind of describe what they're focused in on, and what do you see that's really positive, and where do you think where some legislation might have some, I don't know, I don't know if negative is the right word, but difficult impacts?
That's, yeah, a very good question. I would say that, I think a lot of the legislation isn't healthcare focused. It's quite broad, and I think, it may not necessarily apply to healthcare, but sometimes it can sort of bring us along with that. And so I think those are the bills that, we want to make sure don't adversely affect healthcare, unintentionally. I don't think that's the intention of the bill. We have, there's some that are focused on healthcare, and a lot of it's about disclosure, letting the patient know that you're using AI, and I think that's very valid, and I think that's a great patient advocacy move. There are ones that really restrict, will be overly restrictive, and some of the ones that I'm concerned about where I was telling you we were running predictive models, so we have a lot of AI that's not generative AI, that's actually algorithmic, it's much more scientific, it has a lower chance of any error. And so to categorize all AI the same is a little worrisome, because you'd want to make sure that you're targeting very specific types of AI for these bills, because otherwise you're going to remove a lot of these things that have really improved quality, reduced mortality, and I think these are things that people that do what I do at other health systems, we all have kind of come together to sort of advocate to say, if we're going to pass laws restricting AI, they have to be very specific and also something we can operationalize. So sometimes, you may have this idea of, okay, well, we have to be safe in this manner, but then realistically doing that is very, very difficult because of limitations in technology and workflows, of course.
Interesting. Jared, I see you have your hand up. Feel free to ask your question.
Yeah, sorry, trying to come off mute. Hey, Dr. Patel, what would you say is a problem you have today that you wish AI would maybe help you solve or could save a significant amount of staff time, that you haven't seen that you're kind of curious about? More of a forward-thinking question.
Yeah, I think, I think we all dream of the smart exam room of the future, and I don't know how feasible that is. And, some of these leading innovative health systems will be piloting these where, really you're tech free in a way, and you can just walk in and have a conversation with the patient, take care of them, and then, automatically everything just happens in the background and you don't have to touch a screen. So, I mean, I hope that that's where we head in the future, because I think, I think everyone who goes into healthcare to take care of the patient. Like, nobody thinks about, like, I don't think medical students, well, at least when I was in medical, I never considered the documentation part. I never thought that I would be doing all these other activities, and that would pull me away from the bedside, right? So I would say that if we can kind of reimagine how we deliver healthcare, where we don't have to have all this documentation burden. I know part of it's not just technology limitations, and technology can't solve how we've sort of set up our health system, but I think as much as we can implement that will allow so I would say the technology is kind of how we do a lot of this documentation. So if that can fade into the background, I think that's sort of what I'm really looking forward to. I think we've done a lot of it on the ambulatory setting, with the ambient scribes, but that doesn't necessarily work well in the inpatient setting. So when you think about, nursing, I look at my colleagues and if you're ever hospitalized and, for any period of time, you think about all the time you spend alone in your room, and everybody else is around, and when you go and look to see what people are doing, they're all at computers, because they have to. So hopefully we can find a way to bring all those people back into the rooms and at the bedside, using technology. I think there's things that haven't been created yet that we're going to need.
Yeah, Sharon, you're right from our conversation yesterday. She is pretty awesome.
Oh, thank you.
Hey, I told you guys, I told you she was going to be great. Debbie has a question.
And Debbie needs to get a different background so you can see Debbie's hand. So I behaved myself and I raised my hand. That was very quiet. Just, I need some brownie points somewhere. So So first of all, thank you, Dr. Patel. I don't know if you have a doppelganger somewhere, but I'm looking at you and you look like I know you, but I don't know why I know you. But anyway, maybe from Sharon. I don't know. But I want to go back to your art, your AI artwork. And I work with older adults. We also have little humans at our preschool that come and hang out with our older adults. But we had staff completely opposed to bringing laptops. So we do some complex case management where nurses and social workers go into homes of older adults, and they absolutely refuse to bring laptops because when we transitioned to electronic medical records here, they were like, I am not going to be typing on a computer when I'm meeting with a human being. That is just not something that I'm going to do. And so our workload for our staff, they write up the notes while they're there, and then they come back to the office and they type them all into the system. And this gives me hope that we would have an alternate way to have some efficiencies with them, because I wasn't gonna force them to do that, because I fully agree. I don't love, and my older adults don't love having a conversation with a physician whose head is, the back of their head is facing them. So I just want to say thank you. For the older adult humans, like, that means a whole hell of a lot that a physician can face them and have that conversation with them. I also am particularly excited about notes that accompany people home that are written in plain language that they can refer to after leaving, because oftentimes you will see somebody back in your hospital because the discharge summary was not clear, because it was 322 pages too long and they never read it, because, like, things that have absolutely nothing to do with the medical condition for which they were admitted. So I just am having a lot of appreciation in the overall positive impacts. And I think something that would help, maybe, I don't know, you know physicians better than I do, but uptake, as Joseph brought up, is an interesting sort of place with some of our older physicians who've been doing this for a long time and don't want to sort of change the practice. But if you have the metrics that show how much quicker people are accessing care, to me, that might move a needle with the physician where just the efficiency of the system might not, I don't know. Just thoughts.
Yeah, no,
Appreciate
you
the
raised a
presentation.
lot of, oh, I'm sorry. Yeah, you've raised a lot of really good points. And I would say that, the idea of ambient scribes, I think it started off for doctors, but it's really, I mean, the idea is everyone should be using them. I think we're going to go live with nursing toward the end of the year, but case management. I mean, I would think home health workers. Really, the idea of typing is now a bit outdated. I mean, we've got technology that can get past that. So I think the cost of these tools have really gone down, and so it should be considered for pretty much any type of healthcare worker. And then, your point about, just information being tailored to you. I mean, I think that's the other big area that we're going to see. So while, when you have physicians or people that use these ambient scribes, you can create these personalized instructions, but what about everyone else? So what's going to happen, at least with the electronic health record that we're using, is that all instructions are going to be personalized, because it's going to look at all the information in the chart of your entire hospital stay, and then sort of distill it down to instructions that really matter, and then you have the ability to keep it really succinct, so you don't have to read through volumes, and you'll also have the option to toggle. You could say summarize this, shorten this, which is
Right.
great.
And I think I will just add that is going to be particularly important given the largest segment of the population growing, these older adults, with 85 and older being the largest growing segment of the population, with their 50% risk for dementia or Alzheimer's or something like that. If you're flagging in the medical record, and mind you, it's radically underdiagnosed, so oftentimes you won't have a dementia or Alzheimer's diagnosis, so that's problematic. But let's assume it gets it right, they get the diagnosis, it's going to write very different notes. And if somebody is identified in the electronic health record as a caregiver, that's also going to be very different notes. So it will be hugely helpful in our older adult population in that regard. So we need to get better at
Absolutely.
diagnosing, but that's another story for another conversation. Thank
Yeah, thank you.
Bob, I think you raised your hand first, and then I saw Terry, and then Mandy in that order.
Okay, thanks. Was that me you said, Bob?
Google first.
Okay, thank you. Uh, uh, Good afternoon, everybody. Nice to see everybody. Great presentation, Dr. Patel. I've heard a couple of presentations on AI more directly toward workforce. This is the first one I heard about that really centered on care. Really appreciate that. I do a lot of work in the health workforce training spectrum, and I was just wondering, I mean, you seem to understand AI and healthcare. Um, we do a lot of entry level training, even up as far up as nursing, but mostly, medical assistants, EMTs, surgical techs, a lot of tech positions. What are two or three recommendations you would have of how we might change the curriculum to include whatever individual AI training might be necessary as we move forward? Do you have any thoughts around that? Thank you.
That's a really good question, and something the answer to that changes every day because we're evolving as we go. I think where we started a year or two ago was really around, just basic compliance, like what is AI, how to use it safely, responsibly, how to protect data. I mean, it wasn't the kind of workforce upskilling kind of AI training that was being delivered. It was more about, being cautious. I think now when we implement technology, we're creating training modules of, how do you use this tool, how to use it effectively. So it's very tool specific. We've also started something. So our enterprise large language model is like we have Microsoft Copilot, and so what I've started are these Copilot chat user groups, and it's a nice kind of entryway into using AI safely because it's all of our data is all protected. I think that's like the one thing is, when we start training, I think it's really important depending on the environment that you're working in, and, especially in healthcare, it's like the data has to stay secure. So many people are familiar with ChatGPT. So it's the same idea, but now you're going to work together in groups of people where we all support each other and share ideas of how are we using AI. So that is kind of like a nice kind of a stepping stone of how to use AI. And then within those groups, what ends up happening is there's people who are more advanced, and then they start going down the path of like building an agent. And, I think it's one of these things that you can grow, but to do kind of standard AI training, how to, prompt and do all of that, I think it's tough because, not everyone's going to be engaged in the same way, and they don't necessarily know how to apply it to their group. So, unlike EHR training, like when we were training everyone at Epic, you sat them in a classroom for 16 hours and you're like, here's how you do this. And, this is how you do this with your workflows, and then you'd be done. And they all paid attention because, that was their job. AI kind of feels like something extra. So I think you'll get some engagement, but some not. But if you make it really real and easy and feel like kind of what you're doing on your personal life, it will likely be more successful.
All right, thanks.
Hi, Terry.
Well, Rebecca and Sharon, I want to say, when I saw you put this program together with Dr. Patel, I was thrilled because decades ago, she was my primary care physician. I was sad to see her, leave clinical care, but for the good of the whole, Dr. Patel, you're doing great things. And so mine isn't so much, but you mentioned disclosure to the patient. And I just wanted to pass on. I have a friend who was part of the John Muir group, and she was actually one of these people that reads the consent agreements before you sign. And she had expressed some concern that she was a little worried about what am I really consenting to, but came to the conclusion, well, what choice do I really have? So I don't know if it was if the consent agreement was overly complicated, but I just wanted to pass that on. But in the meantime, thank you for what you're doing.
Thank you, Terry. And it's so nice to see you. It's like such a wonderful experience to see old patients. And, it's, I miss that whole part of my life too, but now you know what I've been up to. Well, I would say that, so that we do have a consent form, and that consent form is really around our ambient scribe. And we were one of the first in the country to go live with this. And so we took a very careful stance. I think you've probably seen through my presentation, like we're just super cautious. And we created a form to fully disclose everything that we're doing with AI. So just down to like where the data flows. And so every patient has a choice. You do not have to consent to that. There's and we would not utilize these tools if a patient did not consent, and that's why there's that intentional of please review this, and if you don't wish to do it, then we wouldn't. What's interesting about that form is it's really related to recording of the voice, because there's a California law that says we're a two-party consent state and we must obtain consent. What's interesting about the rest of the Bay Area is that people were just doing this verbally and not sharing this information. And, so the use of this technology is pretty far and wide. But we kind of made it very transparent, which then, made people, concerned because this is the first time they're seeing it. But I think, I think that's the right thing to do, is to share the information with the patient and then give them the choice whether or not they want to move forward. And so we haven't changed our approach to that, but certainly, we could, I think it's really important for us to share that you don't need to sign this form. You don't have to. It's your choice.
Thank you.
Mandy, your turn.
Thank you. I'll make it quick. I know we only have a few minutes. So, Dr. Patel, thank you so much. I am from the Contra Costa Community College District, and our colleges definitely have the healthcare programs to prepare the students. Actually, my question was very similar to Bob. So you already asked my questions about say curriculum and stuff. So our faculty members are definitely having a lot of conversations about AI and the use of AI in different fields, especially in healthcare field, for example. So I'm wondering if you have anything to add that you would like to share, how higher education institutions can better prepare our students for future workforce to enter into the especially entry-level positions, right, in light of AI.
Yeah, it's interesting. I think the education space is much farther along than healthcare is in contemplating what happens with AI. I've listened to so many podcasts from the educators on how they're approaching this when it comes to how do you train the new workforce, the even the doctors of tomorrow. We have a family medicine residency program here, and I've been partnering very closely with one of their faculty members on how do we introduce these tools to all these young doctors, in a way that doesn't de-skill them and doesn't, affect their ability to develop reasoning and sort of those thinking skills that are so important for physicians. So I'd say that, and I'll just share with you kind of like how we approach it. So in that first year, they do, so it's a 3-year training program. They do not use AI at all, and they're expected to demonstrate competency and some of the things that AI can eventually take over for them. Once they do that, then in the second year, it's slowly phased in as their faculty members can determine that they can do clinical reasoning, and they can sort of formulate assessments on their patients and sort of work through all those like thinking things about, what diagnosis could this be? And then once they can do that, then they are given the full suite of AI tools. But it's done on an individual basis because people learn at different rates. So I think they're, to not give them any of these tools is not sort of seeing the future. So it's this balance of, giving them the chance to develop the reasoning that's required for their jobs is really important. But once they have done that, once they have done that, then you can implement it. Even still, I do think that we are, just natural human behavior. Like we just de-skill very easily. If something else is going to take care of something, it's like, okay, well, I don't have to do that. So I think there needs to be that ongoing sort of like thinking, reasoning exercise that one must have to do. And it's sort of the approach of, all right, I'm going to figure out what I think is happening to the patient. And then I will test my knowledge afterward with the AI. But to sort of start off with it, I think is really tough. And I'm sure that's a very similar parallel to, educating for other professionals. But I think we're all looking to each other for, what is the best approach. And I think we'll find out in 5 to 10 years what happened with the introduction of AI during education.
Thank you so much.
All right. Well, we've actually hit 3 o'clock. So I think thank you all for the wonderful questions. Really rich conversation. Thank you, Dr. Patel, for your great presentation, and Sharon for recommending Dr. Patel to us. Really enjoyed today's conversation. Lot of interesting things to walk away with. Everything from education, training, use cases, adoption. So much to think about. So thank you. Really appreciate it.
Thank you so much for having me. Great to meet you all and appreciate all your questions.
Thank you
All
so
right.
much.
Thank you,
Thank
Meg.
you,
Is there anything we need to
everyone.
do?
Yeah, that's it. Thanks, everybody.